this is the 360-degree view of my room. Before I begin, I'm going to ask Payne if she consents to be my patient.
Yes.
Okay. I'm Izzy Michaud, and I'm going to be doing my validation round 2 today. I'm going to begin by inspecting the head. I'm going to displace any hair and look for any lesions or moles that are present. And there don't appear to be any, but if there were, I would want to do an ABCDE skin assessment on them. Next, I'm going to begin by palpating the skull, and a normal cephalic skull is a round and symmetrical in shape and proportional to the body, and I'm going to use a rotary motion starting from the frontal, going back to the occipital, and then from the temporal up to the parietal, and I'm going to note any indentions, lumps, or protrusions, of which there were none. Now I'm going to move to the anterior side. I'm going to inspect her facial expressions, all of which are normal for the situation. I'm going to look at symmetry of her face, and to assess this, I'm going to look at her eyebrows, her folds of her, or the corners of her mouth, the nasolabial folds, and the palpebral fissures, and all of this is normal and symmetrical bilaterally. And then I'm going to note any involuntary tics or muscle contractions of her face, which there are none. Next, I'm going to move on and palpate the temporal artery. I'm going to want to note the rate, rhythm, and quality, and everything appeared to be normal there. I'm going to now do the temporal mandibular joint, and I'm going to ask Payne to open her mouth. And this should be a smooth movement, which it was. And then I'm also going to do her sinuses. And when I palpate the sinuses, I'm going to want to note size, shape, location, consistency, and if there's any secretions coming from them. I'm going to do the frontal sinus and then the maxillary sinus, and all of that appear to be normal. Next, I'm going to do assess 2 cranial nerves. I'm going to start with cranial nerve number 5, which is the trigeminal nerve. And this is both a sensory and motor nerve. So I'm going to start by doing a pain and light touch test on her. And so I'm going to have her close her eyes. And this is going to be sharp and dull. I'm going to touch all around her face to see if she can detect this.
Dull. Sharp. Dull. Dull.
And after that, I'm going to assess her lateral jaw movement. So I'm going to ask her to move her jaw from side to side, and this should be a smooth movement, which it is. And then I'm going to ask her to clench her jaw so I can assess the temporal and masseter muscles, and I should note the strength and consistency of these. And then also in cessation and when assessing this nerve, I want to make sure I do the corneal reflex test. I'm not going to be doing that for this assessment, but if I was, I would use a cotton tip and I would touch her cornea, and this would cause a blink reflex, which would be normal. Next, I'm going to move on to facial nerve, which is nerve number 7, and this is also a sensory and motor nerve. And for this nerve, I'm going to have her stick out her tongue and close her eyes, and I'm going to put a taste on the anterior 2/3 and have her identify it.
Salt.
And that would be correct. And then I'm also going to have her make facial expressions. So I'm going to have you raise your eyebrows, puff out your cheeks, smile, all of which was normal. Now I'm going to move on to assessing her neck, and her neck is erect and still, which is normal. Her is in the midline, and her accessory muscles are symmetrical on either side. I'm going to do a range of motion of her neck, so I'm going to have her look down, up, sideways, each way, and then touch your ear to your shoulder. Perfect, and all of which was normal. Now I'm going to assess her cranial nerve number 11, which is the accessory nerve, and this is going to test her sternocleidomastoid mastoid and her trapezius. So first I'm going to start with the sternocleidomastoid mastoid by having her move her head against my hand and this way, and then against my hands on her shoulders, and everything was normal there. I'm going to now assess her lymph nodes, and when I'm assessing lymph node, I want to note the size, location, consistency, shape, and any delimitation that's associated with these. So I'm going to assess these bilaterally on each side. First, I'm going to start with the preauricle, the postauricle, the occipital, then I'm going to move to the submental, submandibular, tonsillar, and then down the deep cervical chain, and then the supraclavicular. And now I'm going to assess her trachea. I'm going to look first, and it doesn't appear to be deviating, it appears to be in the midline. Now I'm going to walk my fingers up on either side and just make sure that it is in the center, which it is. Next, I'm going to assess the thyroid gland. The thyroid gland, if it's enlarged, which is called a goiter, should not be palpated, and instead you should use the stethoscope to auscultate for bruits. But because it is not enlarged on patent, I'm going to palpate for it. So I'm first going to have her lean her head forward and slightly to the right. I'm going to deviate her trachea and then have her swallow. And it was non-palpable, which is a normal finding. I'm next going to assess her carotid pulses, and I'm going to do this on each side one at a time and compare the rate, rhythm, and quality, both of which are normal. And then I'm also going to assess for bruits. I'm going to have you exhale and hold it.
Okay.
And there was no sign of bruits. And just jumping back up to lymph nodes, a normal lymph node would be non-tender and movable, and it would be soft. Next, after finishing with the head and neck, I'm going to move on to her eyes. And with her eyes, I'm going to start with a Snellen eye chart and visual acuity, which is going to test the optic nerve, which is nerve number 2. And this is a sensory nerve. And so a Snellen eye chart can be used at long distance, which is 20 feet, or short distance, which is what I'm going to be doing today, which is 14 inches. And so I'm going to set this at the bridge of her nose, and this string is 14 inches away. And I'm going to have her read the smallest line possible.
4, 2, 8, 7, 3, 9.
And she read that line with no errors, which is indicative that that is a line for visual acuity. And if there was more than 2 errors, then I'd have to have her read the next line up and go from there on. But visual acuity and the Snellen eye chart is a fraction, and so 20/20 would be normal vision. And then, for example, 2100 would mean that my patient could be standing 20 feet away from the Snellen eye chart, and a normal person could see what they saw from 20 feet away from 100 feet away. Next, I'm going to move to the movements of the eyes, and this assesses cranial nerves 3, which is oculomotor, cranial nerve 4, which is trochlear, and cranial nerve number 6, which is abducens, and all of these are motor nerves. And so I'm going to start by doing the 6 cardinal fields of gaze, and I'm going to use my pen light to assess this. So I'm just going to have Peyton follow my pen where it moves. And she did all of that completely normally. And then I'm going to move on, and I'm going to do the corneal light reflex. And so I'm going to shine my light of my pen light at the bridge of her nose and just have her look straight ahead. And there should be a symmetrical reflection on each side, which there was, which is completely normal. Now I'm going to move on and do the cover on cover test. So I'm going to use my eye chart again. I'm going to cover one eye for about 10 seconds. Make sure you're focusing just ahead of me. I'm going to remove it, and I should see her eye refocus, which I did. Next, I'm just going to inspect the eyes. And so I'm looking to make sure that the eyelids are not swollen or red, which is would be an abnormal finding, and they aren't. Some other abnormal findings would be exophthalmos, which is going to be bulging of the eyes, incomplete closure, which can be indicative of corneal damage, ptosis, which is going to be drooping of the eyes, periorbital edema, which is going to be swelling, ectropin, which is going to be the drooping of the eye outward, or the rolling of the eye outward, and then entropin, which is going to be the rolling of the eye inward. After I assess that, I'm going to move on to the conjunctiva, which is going to be the kind of protective layer of the eye. And so there are two types, a bulbar, which is going to be white and transparent. And then there's going to be a palpebral, which I'm going to assess by pulling down and having her look up and look down and look each way. And this should be red in appearance, which it was. After I do that, I'm going to look at the sclera, which is going to be white, and it can be bluish in people of color, and there can also be yellow or brown deposits. And then I'm going to look at the cornea, which is going to be smooth and clear, and I'm going to assess this by shining the light. And I can see that it's smooth and clear. And on all these eye tests, I'm only performing them on one side, but I would perform them bilaterally in a normal assessment. Then I'm going to assess the iris, which should be smooth and even in color, and it is. Now I'm going to move on and do PERLA, which is an acronym that stands for Pupils Even Round Reaction to Light and Accommodation. So I'm going to start by assessing her pupils, and they do appear to be round, and then I'm going to use the size on the side to indicate the size of her pupils. Hers are about a 3 on both sides, which is normal. A normal adult should have 3 to 5 millimeter pupils. Next, I'm going to do the reaction to light, and I'm going to shine my light and move it across her eye. And notice for constriction, and there should be a direct constriction in the eye that I shine the light on, and a consensual restriction in the opposing eye, which there was. I'm next going to do accommodation, so I'm going to have Peyton look directly at my pen light and follow it in. And I should see constriction of the pupils and convergence of the eyes, which I did. I'm next going to move on to assessing the ears. I'm first going to assess the ears externally and just make sure their size is proportional to the rest of the body and that their color is the same. And I'm going to assess this. I would assess this bilaterally, but I'm just going to stay on this side just for the sake of this assessment. And I'm also going to palpate for any tenderness. And there doesn't appear to be any tenderness or any lesions. I'm now going to look at, there is some cerumen, and that is completely normal. This is earwax, and that can be yellow in color. It can also be gray, brown, or black. And then it can be a waxy consistency, or it can be dry. I'm now going to begin by looking at the ear internally. And to do this, I'm going to hold my otoscope upside down, and I'm going to pull the peanut up and back and have her tilt her head downwards. I'm going to insert and look. And this is normal for an adult. And then for a child, I would want to hold the peanut and move it downwards just to straighten out their canal. As I looked at the external canal, which I wanted to make sure was not red and free of any lesions. There was no bleeding or any abnormality, and it wasn't swollen. And then I also looked at the tympanic membrane, which is a shiny pearly color, and that is completely normal. After performing that, I'm going to do the whisper test, which is for the acoustic nerve number 8, and this is sensory. So I'm going to stand about 2 feet behind her. I'm going to cover my mouth just to make sure there's no reflection in the room that she can see. I'm going to ask her to cover one ear, and I'm going to just whisper some words.
1,
2,
2,
3.
3,
And then I'm going to ask her to cover the other ear. Cow,
cow,
dog,
dog,
squirrel.
squirrel.
and she performed that completely normal. Now I'm going to move on to assessment of the nose. So I'm going to look at her nose, and I want to make sure it's symmetrical. There's no swelling or rashes present, which there isn't. And then if she expressed any concern about having a broken nose or pain, then I would just palpate it. And then I'm also going to test patency by having her occlude one nostril and then sniff. Can you breathe normally? And then I would do the same on the other side. And this would indicate obstruction. After I do that, I'm going to perform an test of the olfactory nerve, and this is nerve number 1, and it is a sensory nerve, so I'm going to have her close her eyes. I'm going to place a smell in front of her.
Alcohol.
Yes. Now I'm going to look internally at her nose, and I would change out the tip of my otoscope. And internally, the nasal mucosa should be a pink color, and it should look moist. And it should be free of lesions and no swelling. And if there is any discharge, I would want to note this. And I would want to note the color, consistency, amount, and if it had a smell. I'm also going to want to look at her septum, and it doesn't have to be in the middle of her nose unless there was some obstruction causing problems, but I do want to make sure it's straight, which it was. After I do the ears, I'm going to move on to the mouth and the lips, and so I'm going to start by assessing her lips. And her lips are deeper pink than her skin, which is completely normal, and her they're free of cracks and they appear to be moist. And then I'm going to put my gloves on to continue this assessment because I could have exposure and probably will have exposure to body fluids. And so I'm going to pull down her lip a little bit and make sure that the color and texture is consistent, which it is. Next, I'm going to move on and assess her teeth and gums. So I'm just going to have her open her mouth. And I'm also going to get my pen light. And I'm going to look in. She should have 32 teeth, which are all normal size, no missing teeth. And these should be free of debris and cracking and chipping. And all 32 of her teeth look normal. Normally I would count them, but for this assessment, I'm not going to do that. And then I'm going to pull down on her lips and look at her gums. Her gums should be speckled and pink, which they were. After doing her gums, I'm going to move on and do her, do the floor of her mouth. So I'm gonna have her open up. Actually, I'm gonna do her tongue. So I'm gonna have her stick out her tongue, and it should be pink and moist, and I'm going to use gauze to assess this. And it is pink and moist, which is normal. And then I'm going to have her open up and look at the floor of her mouth. And this is the site for oral cancer, so this could have palar cyanosis and lesions. And then I'm also going to look at the buccal mucosa. So I'm going to have her open up, and I'm going to look at either side. And this should be pink and moist, which it is, and it should not have any lesions, any of that. And on darker skinned individuals, it can be a darker brown color. And then I'm gonna have her tilt her head back so I can look at the roof of her mouth. The roof of her mouth contains the soft and hard palate. The hard palate should be white or light pink, and the soft palate should be pink, and it can be movable upwards, and it is also spongy. Now I'm going to assess for her tonsils. So I'm gonna have her open up. I'm going to have her stick out her tongue, and I'm going to look to the back. And have you had your tonsils removed?
No.
And a tonsil has a grading scale of a 1+ to a 4+. A 1+ means the tonsils were visible like Peyton's. And then a 2+ means the tonsils are halfway in between the uvula, and they're just halfway to the uvula. And then a 3+ means they're touching the uvula, and a 4+ means they're touching each other. After I do the tonsils, I'm going to move on and assess the cranial nerves. We have cranial nerves 9 and 10, which are the hypopharyngeal nerve and the vagus nerve, and these two nerves are both sensory and motor. And so I'm going to assess these by having Peyton open up her mouth and say, ah, and I'm going to watch the uvula rise and fall. And then I would also do a gag reflex here, but I'm not going to do that for this assessment, but I would warn her first, and then I would push my tongue stick to the back of her throat, and that would elicit a response. And I'm also going to test the posterior 1/3 of her tongue with taste. So I'm going to have her open up her mouth or her tongue and close her eyes. I'm going to put a taste on the back of her tongue.
Salt.
And then lastly, I'm going to test cranial nerve number 12, which is a motor nerve, and this is the hypoglossal nerve, and I'm going to have her stick out her tongue and move it side to side. And her movement was free and